Hello and welcome. Today, we're diving deep into a common yet often misunderstood condition, dry eye syndrome, also known as Keratoconjunctivitis Sicca. We'll explore what it is, why it happens, and what you can do about it. So, let's get started on understanding this prevalent ocular issue. So, what causes dry eye syndrome? The causes are multifaceted. It could stem from decreased tear production, perhaps due to aging, hormonal changes, or certain autoimmune diseases like Sjögren's syndrome. Sometimes it's about tear film instability, where the tears evaporate too quickly. This could be due to meibomian gland dysfunction, a condition where the oil glands in your eyelids don't produce enough of the oily layer of the tear film, or from environmental factors like dry air, wind, or prolonged screen time. Certain medications, like antihistamines, decongestants, and some antidepressants can also contribute, and even contact lens wear can sometimes be a culprit. Now, let's talk about the underlying mechanisms. In a healthy eye, the tear film is a delicate three-layered structure: an oily outer layer, a watery middle layer, and a mucus inner layer. Each layer plays a crucial role in lubrication, protection, and clarity. In dry eye syndrome, this balance is disrupted. Reduced tear volume or poor tear quality leads to inflammation of the ocular surface. This inflammation further damages the cells responsible for tear production, creating a vicious cycle. The cornea, the clear front surface of the eye, becomes vulnerable to damage from friction and environmental irritants, leading to the symptoms we'll discuss shortly. Dry eye syndrome is remarkably common. It's estimated to affect millions worldwide, and its prevalence increases with age. Women are generally more susceptible than men, likely due to hormonal influences. The condition is also more prevalent in people with certain autoimmune diseases, or those who live in dry or windy climates. As our population ages and screen time increases, we can expect to see even more cases of dry eye syndrome. The symptoms of dry eye syndrome can range from mildly irritating to severely debilitating. Common symptoms include a gritty or sandy feeling in the eyes, stinging, redness, blurred vision, and excessive tearing. Yes, even though it's dry eye, the eyes can overproduce tears in an attempt to compensate. Some people also experience light sensitivity, eye fatigue, and difficulty wearing contact lenses. Symptoms often worsen at the end of the day or after prolonged activities like reading or computer use. Diagnosing dry eye syndrome typically involves a comprehensive eye exam. Your eye doctor will assess your tear volume and tear quality. This can be done through tests like the Schirmer test, which measures tear production, or the tear breakup time test, a TBT, which assesses how quickly your tears evaporate. They might also use special dyes to look for damage to the cornea and conjunctiva. A thorough evaluation will help determine the severity and underlying cause of your dry eye. While there aren't distinct types in the traditional sense, dry eye syndrome is often categorized based on its underlying cause. You might hear terms like aqueous deficient dry eye, which indicates insufficient tear production, or evaporative dry eye, which suggests that the tears are evaporating too quickly. Understanding the root cause is crucial for tailoring the most effective treatment plan. Fortunately, there are many ways to manage dry eye syndrome. Treatment options range from simple over-the-counter remedies to more advanced medical interventions. Artificial tears are often the first line of defense, providing lubrication and relief. Prescription eye drops, such as those containing cyclosporine or lifitegrast, can help reduce inflammation and increase tear production. In some cases, punctal plugs may be inserted into the tear ducts to block drainage and keep tears on the surface of the eye longer. Warm compresses and lid hygiene can help with meibomian gland dysfunction, and in severe cases, surgery may be necessary. While you can't always prevent dry eye syndrome, there are steps you can take to minimize your risk and manage your symptoms. Avoid dry or smoky environments. Use a humidifier, especially during the winter months. Take frequent breaks during activities that require prolonged screen time. Blink consciously. Stay hydrated. Ensure you're getting enough omega-3 fatty acids in your diet, and if you wear contact lenses, follow your eye doctor's instructions carefully. The prognosis for dry eye syndrome is generally good. While it's often a chronic condition, it can usually be managed effectively with the right treatment and lifestyle modifications. Recent research is focusing on developing more targeted therapies that address the underlying causes of dry eye, such as new anti-inflammatory medications and advanced treatments for meibomian gland dysfunction. Scientists are also exploring the potential of regenerative therapies to restore tear gland function. The future looks promising for those living with dry eye syndrome.